Good afternoon, everyone. I'm a dietitian at Tan Tock Seng Hospital. Okay, so I graduated with a Bachelor of Nutrition and Dietetics from Flinders University in Adelaide, South Australia. My job scope is to empower patients and carers with skills and knowledge to make dietary changes according to their medical conditions, such as SLE. I'm also largely involved in food service in the hospital, so I do some improvement in the menu, in the meal ordering system, and some quality improvement project for food service as well. And of course, I do support nutrition-related talks and events such as today. So the content for today would be what is SLE, followed by some nutrition tips. So let's start out with what is SLE. So SLE, otherwise known as lupus, is an autoimmune chronic condition caused by a malfunctioning immune system, whereby the immune system attacks healthy tissue, resulting in inflammation. It's a systemic condition that affects the entire body, involving the skin, the joint, the brain, the kidney, and heart. Therefore, SLE patients have higher risk of developing cardiovascular and kidney diseases. So there is no exact cause of SLE. It is also not directly caused by diet, but there are some links with genetics or ethnicity. So the common treatment of SLE is to use corticosteroids such as prednisolone, and this is used to manage inflammation. However, if patients are on high-dose steroids, it may result in the side effects that you can see on the slide, such as weight gain, high blood sugar, or it may trigger or worsen diabetes. It can also increase the risk of cardiovascular diseases, high blood pressure, osteoporosis. It may also result in fluid retention, resulting in swelling in the legs. Therefore, the nutrition goals is to manage the potential complications associated with SLE and improve the quality of life. And do bear in mind that the diet needs to be tailored to individual needs and condition of the patient. So moving on to nutrition tip, there will be two segments. The first segment will be on My Healthy Plate. Have you all seen this before? It's quite commonly used by Health Promotion Board. So it's important to have a healthy, balanced diet, which involves having a wide variety of food across the different food groups, as you can see on the plate on the slide. And this plate actually serves as a visual guide to guide you in visualizing and planning a healthy diet. So the first component of My Healthy Plate would be the brown rice and wholemeal bread category. And basically, this is the group of carbohydrates. And carbohydrate is the main fuel source for the body. So examples of the brown rice and wholemeal bread food group would involve like bread, noodle, biscuit, rice, chapati, and oats. And it's recommended to take around 5 to 7 servings a day, and the serving size is shown on the slide as well, all of which is encouraged to go for 2 to 3 servings of whole grain products. And the rationale is because whole grain products are higher in fiber. So fiber is the indigestible portion in the plant food, and the benefits are that it helps to prevent rapid rise in the blood sugar level. It can help to lower cholesterol level. It can also promote a sense of fullness, so you eat less of other food, therefore helping to reduce your total calorie intake, which may help in weight management. And of course, fiber can help to prevent constipation. So to obtain enough fiber, other than going for whole grain products like wholemeal bread, multigrain bread, brown rice, and oats, it's also important to have enough fruits and vegetables. And this brings us to the next category of my healthy plate, which is the fruits and vegetables category. So for fruits, it's recommended to have 2 servings a day, and the serving size is as per what you can see on the slide, such as 1 small apple, 1 wedge of watermelon, 10 small grapes, or 1 medium banana. As for vegetables, it's also recommended to go for 2 servings a day. And if you're talking about raw vegetable, that would be around 150 grams. If let's say you're talking about cooked vegetable, is around 100 grams, which is 3/4 of a cup. Okay, so the last category of my healthy plate would be meat and other alternatives, and basically this is the protein food group. So proteins sources would be things like meat, fish, chicken, milk and dairy products like yogurt, bean curd, prawns, beans, and eggs. So the benefits of protein is that it's important to maintain our muscle strength and also the immune system, and it's helpful in wound healing as well. So the main takeaway point from my healthy plate is basically it's important to have a healthy, balanced diet in appropriate portion across the different food group for general health. So right now, we're going to move on to the dietary management of potential complications associated with SLE. So it's important to bear in mind that the diet needs to be tailored to individual's condition based on your medical condition or treatment, because excessive and unnecessary dietary restrictions can actually put you at risk of nutritional deficiency. So just a quick recap is at the start of the presentation, I shared that SLE patients have higher risk of cardiovascular diseases and also kidney diseases. And the treatment using the steroids may also cause side effects such as weight gain, high blood sugar, high blood pressure, and cardiovascular diseases. So the subsequent slides will be more on tackling what we can do in our diet to actually manage this kind of complications. So as I shared earlier on, high-dose steroids may result in weight gain. So if you are overweight or obese, so you can tell whether you are overweight or obese using the BMI, the body mass index, which is calculated by the formula you can see on the screen, which is your weight in kg divided by your height in meter times your height. So the healthy weight range should be between a BMI of 18.5 to 24.9. So if your BMI is higher than that and you are overweight or obese, then it will be encouraged for you to lose weight to the healthy weight range. So overweight or obesity can be caused by different factors such as excessive dietary intake, a lack of physical activity, or a side effect of high-dose steroids. And the reason why we are concerned about being overweight or obese is because this can impair insulin sensitivity, which will then increase the risk of diabetes or worsen your diabetes control. At the same time, having a high body weight can also increase the risk of high cholesterol, hypertension, heart diseases, and stroke. So what we can do is to aim for around half to 1 kg weight loss per week, and this can be done by having a healthy balanced diet with lower calories intake, at the same time going for around 150 minutes of moderate intensity exercise per week. So what do we mean by a healthy balanced diet with lower calories intake? So what we can do is to limit things that are high in refined sugar and high in fat, because things that are high in fat and sugar tends to be higher in calories. So reducing refined sugar intake, the food that are shown on the slides are the things that are high in sugar, like cake, whey, ice cream, chocolate, sweets, sweet dessert, sugar, honey, or condensed milk that are commonly used in our drink. So, as mentioned earlier, if let's say we can cut down on refined sugar intake, that can help to reduce the overall calorie intake, which may help in weight management. At the same time, we need to bear in mind that things that are high in refined sugar, they are digested much quicker, which can lead to a higher and faster rise in the blood sugar level, and is therefore not good for patients with high sugar level or who are diabetic. At the same time, things that are high in refined sugar can also increase the triglycerides, which is a type of bad cholesterol in the blood, and this can then increase the risk of heart disease and stroke. These are some other things that are high in sugar, like 3-in-1 drinks, fruit juice, malted beverages like Milo and Horlicks, cordial and other sweet drinks. So some of the practical tips that we can do would be to replace this kind of sweet drinks with the sugar-free products like plain water, black tea or black coffee without sugar, diet soft drinks like Coke Light, Pepsi Light, and also sugar-free sweets. So after talking about reducing things that are high in refined sugar, we're going to move on to things that are limiting the fat intake. And once again, things that are high in fat tends to be higher in calories as well, which will then lead to weight gain and will actually increase the risk of overweight and obesity. So as you can see on the slides, the fats can actually be hidden fats or visible fats. So visible fats will be things like the skin and also the fats on the meat, on the chicken, or it can be the layer of oil that is floating on top of the soup or gravy. It can also be hidden inside your deep fried food like the youtiao, your fast food, as well as your cake and pastries like the egg tart. It can also come from the full-fat dairy products like full cream yogurt, full cream milk, butter, and also some of the unhealthy hawker food as well. So some of these foods are high in saturated fat, which is the unhealthy type of fat that can increase your blood cholesterol and increase the risk of heart disease and stroke. So what we can do in our diet is to avoid adding gravy. If you want to eat noodle, instead of going for the fried or the dry version, you can go for the soup version. To replace flavored rice like chicken rice, nasi lemak rice, or nasi biryani rice with plain rice. To replace the full cream milk or the full fat yogurt with the low fat or no fat or the skim versions. To replace deep fried food with healthier cooking methods like stir frying with less oil, steaming, grilling, boiling, or baking as well. So we have talked about what we can do to manage our weight. Now we're going to move on to what if you have got elevated sugar level or diabetes. So remember at the start we talked about my healthy plate, the wholemeal bread and the rice category, and they are the sources of carbohydrates. So this kind of food will be digested to form sugar, and the sugar will get absorbed into our blood. So our body has an organ called the pancreas, okay, and it can produce a hormone called insulin. Insulin's job is basically to move the sugar from the blood into the body cells. So what happens when a person has diabetes is because the insulin is not enough in terms of quantity, or it's just not working so well, there's insulin resistance, which makes it hard for the sugar to move from the blood into the body cells. Therefore, a lot of sugar remains in the blood. You have high blood sugar, which can result in long-term complications like affecting the eyesight, the kidney function, and amputation. So what we can do if your sugar level is high, or if let's say you're diabetic, is to maintain a healthy weight. Why? It's because being overweight or obese will actually worsen the insulin effectiveness. At the same time, to have 3 regular meals with consistent and appropriate carbohydrates intake so that your sugar level would be balanced and regular throughout the day. Whereas if a person is someone who frequently skips meal or have different portion of food throughout a day, the sugar level would be like a roller coaster going up and down, which is not good for overall diabetes control. Of course, another thing would be to limit refined sugar intake because this sugar gets digested very quickly. It's going to increase our blood sugar very quickly and also increase it very high. Lastly is to have higher fiber intake because fiber will actually slow down the digestion of carbohydrates, and this can lead to lower and slower rise in your blood sugar level. And also remember, fiber provides a sense of fullness, which may help in keeping you full and reducing your overall calorie intake, which can then help in weight management, which is the first point. So now we're going to move on to what if you have got high cholesterol or cardiovascular diseases. So what you see on the left is a very healthy artery, okay, that is not blocked. But what happens if you have got high cholesterol, the bad cholesterol like the LDL and the triglycerides that I mentioned earlier on? It can lead to the blockage of the blood vessel, which will make it hard for the blood to flow through. If it cannot flow to the brain or the heart, it may cause stroke or heart attack. So what we can do is to, of course, maintain a healthy weight, because having a healthy weight can help to bring down your cholesterol level. Limiting things that are high in saturated fat and refined sugar, and I shared with you the rationale and the food examples earlier on, and also increase fiber intake, especially soluble fiber, such as oats, legumes, fruits, and vegetables. So now we're going to move on to the last condition. So what if you have got kidney condition? Because remember at the start I shared that one of the complications of SLE would be kidney disease. Okay, so the role of the kidney is basically to remove waste products like urea, creatinine, potassium, and phosphate from the body. So if the kidney is not working well or it's failing, it will be unable to remove the waste product. A lot of waste product remains in the blood and it can cause some side effects or complications. And in severe cases, patients will require dialysis. So if you have got kidney condition, it's important to have an appropriate protein intake, to limit food that is high in sodium, which is basically high in salt. And if your blood test result shows elevated level of potassium and phosphate, you will need to limit this food as well. So for appropriate protein intake is basically things that are high in protein, which is what I've shared earlier on, like meat, milk and dairy products, egg, tofu, and beans. It gets digested to form waste products like urea or creatinine. If the kidney is not working well and these waste products accumulate in the blood, it can cause side effects like loss of appetite, nausea, vomiting, and weakness. So if you have got a weak kidney but you have yet to commence on dialysis, you will need to limit your protein intake to prevent excessive accumulation of the waste products, and this can be beneficial in slowing down the progression of kidney disease and the need for dialysis. On the other hand, if you are already on dialysis, the management will be very different. You will need to increase your protein intake to account for the loss in protein during dialysis. So it would be good to consult a dietitian for individualized recommended protein intake. In terms of limiting sodium intake is because excessive sodium intake can worsen high blood pressure, hypertension, and this can then increase the risk of stroke and worsen your kidney function. At the same time, sodium in the body will tend to cause the body to retain more water, and this may result in swelling of your lower limbs. At the same time, when you take things that are very salty, it makes you feel very thirsty, and it may make it hard for you to keep to your fluid restriction. And fluid restriction is quite common in patients with advanced stage of kidney disease. So what we can do is to limit to less than 5 grams of salt a day, which is less than 1 teaspoon of salt per day. So things that are high in sodium would be things like canned food and preserved food, like the salted egg, seasonings that is commonly used in cooking, snacks like our tidbits, instant noodle as well. Okay, so what we can do in our diet would be to replace the high sodium seasoning with fresh herbs and spices, to choose fresh food instead of processed food like ham, sausages, canned food like luncheon meat, or salted egg, preserved vegetables, etc. To order soup noodle instead of dry or fried noodle, and making sure to just eat the ingredients and the noodle and leave behind the soup, because the soup is where the sodium is left behind. And also to avoid gravy. Okay, so now we're going to move on to the last 2 waste product, which is potassium and phosphate. So potassium is a kind of waste product, and if let's say there's excessive level in the blood, it may cause weak heart, fatigue, and poor respiration. And certain hypertension medications like losartan can also increase your potassium level. So if your blood test result shows that you have got high potassium level, you will need to avoid food that are high in potassium. So food that are high in potassium are commonly found in fruits and vegetables. So what you can see on the screen is a traffic light system. Basically, if the fruit is under the red category, just like when you cross the road, you see the traffic light is red, it's dangerous to cross. So this food group is actually high in potassium, and you will need to avoid this kind of fruits. So banana is a very common culprit. Okay, for things that are medium in potassium, such as like lychee, orange, papaya, these are the things that you can take once or twice a week, but not more than that. As for things that are low in potassium, that is under the green column, okay, just that when you cross the road, if it's green light, it's quite safe. These are the fruits that are low in potassium. You can have it daily, but bear in mind to limit to 2 servings a day, and the serving size is what you can see here. I know it's very wordy over here, so we have the pictorial form. Okay, so these are the things that are low in potassium and is safe for you to take. Alright, so moving on to vegetable is also the same concept. Things that are high in potassium you will need to avoid, and basically green leafy vegetables like kailan, spinach, all these are high in potassium with the exception of kangkong. Okay? So a very simple tip would be if it's green leafy veg, then it's not suitable with the exception of kangkong. Okay, potato is also another common culprit that is high in potassium and needs to be avoided. So once again, the low potassium vegetable, we have extracted out a few examples to be shown here. So it's okay to take it on a daily basis, but bear in mind to just take only 2 servings a day. Okay, yeah. Alright, so we're going to move on to other high potassium food to avoid would be the whole grain bread and cereal like wholemeal bread, brown rice, and oats. Tomato puree like your pasta sauce, your tomato ketchup, chili sauce, meat and vegetable extracts or stock cubes that is commonly used in making soup. Nuts, your peanuts, your seeds like sesame seeds, coconut products like kaya, nasi lemak rice, peanut butter, chocolate and potato chips, brown sugar, all this. So these are the high potassium food that needs to be avoided. So as you can see, a low potassium diet is very restrictive. So you only need to restrict if your blood test result shows elevated level. And some of these high potassium foods are also high in phosphate as well. And phosphate is the last toxin that I'll be sharing on today. And why we are concerned about phosphate level is because high phosphate level can cause weak bone, joint pain, and itchy skin. So once again, if your blood test result shows elevated phosphate level, you will need to avoid this food like sardines, ikan bilis, dried prawns, chicken feet, organ meats, egg yolk. Egg white is okay, it's the egg yolk that is high in phosphate. And once again, the common food like nuts and seeds, whole grain products that I shared just now, they are also high in potassium. And also things like chocolate, dried mushroom, keropok, malted drinks like Milo, cocoa drink, cola-based drinks like Pepsi, and also Coca-Cola. Okay, so in summary, we have shared about the dietary management to manage the symptoms and complications of SLE treatment and to improve the quality of life. And do bear in mind that the diet needs to be tailored to the individual needs of the patient.